So today I've been sent to Eleanor. She's a 65-year-old female. She has collapsed while out watching the Anzac Day parade. On arrival, Eleanor was sitting down. She was alert orientated. She was able to greet me. Circulation was looking good. She was maintaining her own airways, effective breathing, able to self-mobilise into the ambulance. My crew partner has already obtained a set of vitals, so we have a BP of 140 over 90, a respirator 14, heart rate of 105, BGR 5.9, temperature of 37.1, and an SpO2 of 99%. So those are all within normal ranges. Cool, so I'm just going to ask you a few questions, Eleanor. So tell me what's happened today.
Just watching the Anzac parade outside and just started feeling a bit faint and dizzy and yeah, vision just went black and I woke up on the ground. My husband just said that he caught me. Yeah, don't really remember.
Okay, so I've got her husband over here. So do you know if she lost any consciousness?
Briefly for about 10 seconds, and she woke up and she seemed to be fine. She didn't have any...
Yeah, she returned back to normal?
Yeah, she didn't.
Quickly?
She didn't have anything happen as well. She didn't have a seizure or anything like that.
Yeah, and she didn't hit her head?
No, I managed to catch her as she fell.
Okay, cool. And so has something like this happened to you before?
Not since I was about 30 or something that I fainted.
No, do you have any medical history at all? Or
No,
on
pretty
any
healthy.
medications?
No.
Okay, that's good. You're nice and healthy.
Yep.
I'm pretty certain you have had a syncope, which is like a loss of oxygenation to the brain, and that just causes you to faint for a few seconds and regain consciousness completely. But first I want to rule out any significant differential diagnosis. So I have seizure is a big one. The husband said that she didn't have any seizure activity. So I'm not suspecting that. I can look at her pupils to see if they're dilated, which would be a sign of someone seizing, and also if she had bitten her tongue. Can I have a look at your tongue? Cool, so I don't think she's bitten her tongue, so I'm not suspecting a seizure. She doesn't have any medical history of seizure either. Next, hypoglycemia. She has a normal BGR of 5.9, so I can rule that out. And also stroke is another one, so I'm going to perform a fast test on my patient. Well, Eleanor, I'm just going to do a few tests on you. So would I be able to get you to squeeze my hands? Yep. Cool, so there's even strength in both hands. Can I get you to give me a big smile? Oh, she's got an even smile. Could you poke out your tongue? Yep. Cool, would I be able to get you to hold your hands up like that?
Yep.
Flip them so your palms are up. And then close your eyes. Cool, so there's no drift, so there's not suspecting any one-sided weakness. And Eleanor, do you know what day it is today?
It's Tuesday.
Tuesday, what's the date?
I don't know. 17th.
Yeah. Okay.
I wouldn't usually know, so.
Okay.
Yeah.
Yeah, so I'm not suspecting a stroke. Fast test is negative. Cool, so I am suspecting that the patient has had a syncope. So I want to differentiate whether it was a cardiac cause, which is the most detrimental one. So Eleanor doesn't have any cardiac history. We had gained a 12 lead and it is looking normal sinus rhythm. There's no arrhythmias, dysrhythmias. She doesn't have any hypotension or any cardiac disease, so I can rule that one out. Orthostatic hypertension is also a common cause of syncope. So that is when someone stands up and then their blood pressure drops, and so that results in less blood going to the brain, and that can cause someone to faint. Also give that head rush feel. So just to test this, I'm going to take Eleanor's blood pressure standing up, and if I see a drop of 20 systolic or 10 diastolic, then I'm suspecting that that could be a cause. So Eleanor, I'm just going to take your blood pressure again. Would you be able to stand up for me? Okay, so I got a systolic of 140 and a diastolic of 90, which means there has been no change to the blood pressure, so I'm not suspecting an orthostatic hypertension. So you can grab a seat back down now, Eleanor. So I have now ruled out a cardiac syncope and also orthostatic hypertension. So I'm suspecting that the cause of Eleanor's syncope was in fact a neurally mediated syncope, which is the most common cause of syncope. So that can be separated into three categories. We have vasovagal syncope, which can be caused from like an extreme emotional trigger such as pain, emotional distress, fear, something in a medical setting which could cause someone to faint. And this happens by reducing the blood pressure and heart rate, and also things like standing in the heat for a long time as well. There's also situational syncope, so something like fainting, when you're excreting from the straining, painful urination, there's mitral syncope, which can be caused from dehydration or alcohol, and also vomiting after eating a heavy meal, and also carotid sinus syncope, which is due to the hypersensitivity of the carotid sinus. So because Eleanor wasn't doing anything at the time, she was standing out in the heat for long periods of time, suspecting it could be a vasovagal syncope, just from standing out in a long time. But I can also check what her fluid intakes have been like. So have you been drinking much water? Enough water recently?
Not really, I forgot to bring my bottle after the parade.
Okay, cool. And have you been eating today?
I had breakfast, so...
Yeah, and you haven't had any nausea or vomiting?
No.
Okay, so I think it's really important for you to keep up your dehydration levels, and also just take a rest. But I'm going to check with my crew partner, because your signs are looking completely fine, you don't have any severe medical history, and I think we can be sure that the syncope was probably because you've been standing for a long time in the heat. I don't think that we need to take you to hospital, so I'm just going to go over the red flags for syncope in the St. John CPGs, which determine if we need to take you to hospital or not. So abnormal vital signs, all your vital signs were looking normal, failure to recover to normal, and you look fine to me, and your husband stated that you were recovered back to normal. Abnormal 12-lead ECG, your ECG was looking perfectly fine. Your unexpected shortness of breath, were you experiencing any shortness of breath at the moment?
No, not at all.
Cool. Clinically significant injury, she did not gain any injuries, someone caught her when she fell. Pregnancy, not pregnant, are you?
No.
Cool. Headache, do you have any headaches at the moment?
No pain anywhere.
No. Valvular or congenital heart disease, you don't have any cardiac history, and we didn't find anything on the ECGs, so I think that is fine. Orange flags, this is to determine whether you should see a doctor within 24 hours. So you're above 16 years old, you don't have postural hypertension. Do you have a family history of sudden death?
No, not that I know of.
No. And history of heart failure? No. Cool, so I don't think you need to see a doctor. I'm also just going to check our non-transport checklist just to be sure that we can see you leave you at home safely. Yep. So patient has been fully assessed, including a full set of vitals and appropriate investigation. Yep. And none of the vitals are significantly abnormal. Yep. No red flags are present. Yep. Patient is sent to mobilise. Yep, we saw you mobilising into the ambulance all by yourself. The patient and caregivers have been given an explanation of when to seek further help. Cool, so are you happy for us to leave you at home?
Yeah.
You're fine? Cool. And if anything like this happens again, or if you are concerned, then you're welcome to call us back or go to see your GP as well. Cool. And PRF has been completed in copy and has been left with the patient and giving instructions. So we're going to write you a bit of paper, and that'll just be everything that we've done, and if you do go to your GP, you can take it to them.
Okay.
Cool, so are you happy?
Yep,
Yeah, just remember to rest and keep up with your hydration levels.
Yep, will do.
Cool, thank you.
Today I've been called to Caitlin. Caitlin's called the ambulance after suffering from some lower back pain. Me and my officer have responded. My officer has just performed a full set of vital signs and gone through doctor's ABC with Caitlin. The airway's paid and she's conscious and alert. She's well perfused and she's talking to me. Her vital signs have come back all within normal ranges, and now I'm going to demonstrate a more focused assessment of Caitlin's back pain and what we're going to do, or how we're going to go in terms of a diagnosis and where we're going to go from there. So Caitlin, tell me what's been going on today?
Oh, I was just doing some laundry and just bent down to pick up the laundry basket, and when I stood up my back just started hurting pretty bad.
Okay. So right now, what would your pain be out of 10? 10 being the worst pain ever, 1 being no pain.
Probably give it a 3.
Okay. So tell me about this pain. Does this pain go anywhere at all? Does it radiate down your legs, or is it just in your back?
No, it's just sitting in my lower back.
Okay. Is that pain like a sharp stabbing pain, or is it like a dull throbbing pain?
Yeah, probably more of just a dull pain.
Okay. And do you have any pain anywhere else apart from your back?
No.
No. Do you have any discomfort anywhere? Do you feel nauseous at all?
No.
You don't feel you've got a headache or anything like that?
No.
No? Okay. So it sounds like you've strained your back at some point. Does anything make that pain better or worse?
Nothing really makes it better, but it gets a bit worse when I walk around.
Okay. So just to rule out some other things going on, do you have any other medical conditions at all?
No.
No. Do you take any medications?
No.
Okay. Have you ever had any trauma to your back or spine? Have you been in a car crash or anything like that? No. Okay. And have you ever had any kind of cancer at all? No. Okay. Have you been well recently?
Yep. Yep.
No coughs or colds?
No.
No. Okay. And have you been going to the loo okay?
Yep.
Yep.
Yeah, everything's normal.
Okay. When did you last pass a bowel motion?
About 2 hours ago.
Okay. Was that before or after you hurt your back?
A little bit after, maybe half an hour after.
Might sound like a weird question, but when you went to the loo and you passed your bowel motion, did that feel normal?
Yeah. Yeah, everything was
okay.
normal.
Have you been short of breath at all recently? No? Okay. Fantastic. Just asking those questions just to make sure you haven't got any likelihood of an infection or any kind of trauma or malignancy that could be going on to cause you this pain in your back.
Okay.
Okay, so what I might do now, Caitlin, is I might just have a quick assessment of your back. I'll just pull your shirt, the back of your shirt up, just to have a quick look at your back. Is it right if I just palpate down your spine and around the top of your buttocks?
Yeah, that's
okay.
fine.
I'll just get you, you can stay sitting and then I'll just pull your shirt up, okay? Okay, now I'm just looking at Caitlin's back, just checking for any signs of swelling or bruising, any asymmetry, anything that could indicate she's had any kind of spinal injury or anything like that. Okay, I'm just going to palpate down your spine, okay, Caitlin? Do you have any pain up here, up in your higher spine?
No.
Anything down here?
No.
No. Anything down here?
No, it's just where it's a bit sore.
Okay. Is it more on the side here?
Yeah, just on the sides of the spine.
Okay. And right here?
Yeah.
Yep. Does that get worse if I press on it?
No, not really.
Not really? Okay. Anything down here on your buttock?
No.
No. Anything around the side? No. Anything on this side around your buttock?
No.
Okay. Fantastic. Well, just double checking. What we might do now, Caitlin, is I might just get you to lie back on the sofa. I might just palpate your abdomen and then a bit more around on your thighs and down on your legs. Is that okay?
Yep, that's okay.
I'm just going to palpate on your abdomen, okay?
Yep.
Right. Any pain or tenderness up in here?
No.
Down here?
No.
How about on the side?
No.
Okay. And up here? No. Okay. Anything around the side here? No. Anything on the side?
No.
No. Okay. Now I'm just going to quickly touch around the side of your buttock and your thigh. Is that okay?
Yep.
Yep.
That's okay.
Do you have any altered sensation or pain around here?
No.
How about around the top, around your buttock?
No.
Anything up here on the side, coming around the side of your thigh?
No.
Do you have any pins and needles or altered sensation down here?
No.
Okay. I'm just going to quickly touch on your legs and your feet, okay?
Yep.
Do you have any altered sensation or pain up here just above your knee?
No.
No. Anything down here just on the right side of your calf muscle on the front around here?
No.
No. Okay. And you didn't have anything up on top of your buttock either?
No.
No,
It's
okay.
just that lower back.
Just asking these questions to Caitlin just to check if there's any L4, L5 or S1 involvement in her injury, but it doesn't sound like that's the case. We've got no altered sensation, no altered neurological function at all. Do you have any, might sound like a weird question, Caitlin, but do you have any altered sensation down in your saddle area, around on the inside of your groin and inside of your thighs?
No, it's just that lower back.
Just in your lower back, okay? Alrighty. I'll just quickly feel on top of your feet and get you to push back and stuff, okay?
Yep.
I'll just check for a pedal pulse, just to make sure that Caitlin's got good perfusion to her lower legs. Okay, we've got a good pedal pulse in that foot, and in that foot. Can you tell me which foot I'm touching right now, Caitlin?
Left.
Left.
Right. Both.
Great. Okay, Caitlin, what I want you to do is push away for me on your feet as hard as you can. That's the way. And can you pull towards you? That's the way. Same on this foot, push away as hard as you can. And pull towards you. Fantastic. Okay, that's all good, Caitlin. You can sit back up now if you like. What we might do now, Caitlin, is I might just see how you feel on your feet, just see if you're okay to stand up and walk around. After your injury, the last couple of hours, have you been alright to walk around by yourself?
Yeah. It's just
Okay.
a little bit more sore when I walk around.
Okay, just a little bit more sore. Alrighty. What I might do, Caitlin, is I might just get you up on your feet. I'll help you if you like. How do you feel on your feet just standing there?
Yeah, I feel okay.
How's that pain in your back?
It's a little bit worse when I stood up, but yeah.
Okay. Do you just want to take a few steps across the room? Just walk back and forth a few times across the room. How do you feel on your feet?
Pretty good.
Okay, do you feel as though you're mobilising normally?
Okay.
You are? Okay,
Mhm.
fantastic. Have a seat.
Cool.
Okay, so what it sounds like is you haven't got any pain or altered sensation in your legs. You haven't got any involvement with your spine. You've got good neurological function, and you haven't got too severe pain or anything. You've been going to the loo okay?
Mhm.
Great. What it sounds like has happened is you've had a bit of a muscular lumbar back strain. So you've gone to pick up something heavy and you've just strained a muscle in your lower back.
Yeah.
What that sounds like to me is you don't need to go to hospital, especially because we've had checked you out and you seem okay. However, it might be a bit painful for a little while, and sometimes back pain can take a while to go away. What we think has happened here is very common with back pain. It's in a vast majority of people with pain in their back. Have you taken any medication for the pain?
No, I don't have anything at home.
Okay. What we might do is we might give you some pain relief. We might give you, how much do you weigh, Caitlin?
60.
60 kilos. And are you allergic to anything at all?
No.
Okay. What we might do is I might quickly give you some paracetamol and ibuprofen. That might help you just manage well at home.
Okay.
If you're still too sore and you're not managing at home, you can just pop down to your local supermarket or pharmacy and get some pain relief over the counter. And if that's not helping, you can always go and see your doctor and talk about it, and they might be able to prescribe you something a bit stronger just to help you cope.
Mhm.
Because it doesn't sound like you need to come with us to hospital, I'm just going to quickly run through some red flags and a non-transport checklist.
Okay.
Do you have any questions for me right now?
No questions.
Fantastic. Next, I'm just going to quickly run through my red flags for non-traumatic lumbar back pain. Caitlin doesn't have any loss of bladder or bowel control. She doesn't have a temperature of greater than 38 degrees. She hasn't got any rigors or abnormal vital signs. She hasn't got any pain in her thoracic spine or chest. She's got no abdominal pain or tenderness, no altered sensation in her saddle area. She's got no altered sensation or loss of power in both her legs. She can walk okay. She's got no signs or symptoms of generalised illness, and she hasn't got pain in either of her legs. She hasn't got any of the orange flags for non-traumatic lumbar back pain as well, which would require us to get her to see a doctor within 24 hours. Caitlin here, also, while she doesn't have any of the red flags associated with that will require a trip to hospital, Caitlin also does not have any of the orange flags that suggest she should see a doctor within 24 hours. You don't have any history of cancer at all? No?
No.
You're not immunocompromised, you're not taking steroids or any chemotherapy medicines. You don't have any worsening pain, especially when lying down or at night time. Have you had any recent unplanned weight loss at all?
No.
No? Okay, good. You don't have any altered sensation or power down one leg. You don't have any pain radiating down one leg. You don't have any osteoporosis or any history of IV drug use?
No.
No, fantastic. So it's also likely that Caitlin doesn't need to see a doctor within 24 hours. So what it sounds like, Caitlin, is that we don't need to take you to hospital and you don't need to see your doctor. But before we leave you home, we just have to complete a non-transport checklist, and we're going to fill out a little bit of paperwork just to leave with you here, with some instructions for you, just in case you forget, about just managing your pain with some pain relief, and with going to see your doctor or going to A&E, or even calling us back if you're worried or your pain's not getting any better.
Okay.
We've fully assessed Caitlin and gained a full set of vital signs. None of these vital signs are abnormal. Significant illness or injuries being excluded. No red or orange flags are present. Caitlin's been seen to mobilise well, and she's been given an explanation of what's going on or whether to seek further help. We're just going to quickly complete our paperwork and leave that with Caitlin. I'll quickly pop out and get some paracetamol and ibuprofen and give Caitlin 1 gram of paracetamol and 400 milligrams of ibuprofen. If that's how much did you say you weighed again, Caitlin?
60.
60 kilos. Okay, that's the dosage we're going to give you. If you're not managing your pain at home by yourself, you can always just pop down to your supermarket or pharmacy and get some paracetamol and ibuprofen and then manage your pain that way. If your pain's still not under control there, you can always go and see your doctor and they can prescribe you some stronger pain relief to help you cope at home.
Okay, sounds good.
Do you have any questions for me now?
No.
No? Okay, fantastic.
So our crew was dispatched to a 30-year-old male with a headache. We've already done the initial assessment, doctor's ABCs was fine, and all the vital signs came back within normal limits. So I'll just begin with a deeper assessment. So Oscar, what's been happening today?
Oh, I've just got this real killer headache.
Killer headache.
Yeah.
And when abouts did that start?
Oh, about 2 hours ago.
2 hours ago.
Yeah.
And what were you doing when it started?
Oh, I was just sitting down watching TV.
Watching TV?
Yeah.
Okay. And whereabouts is that pain in your head? Can you point it out to me?
It's kind of like right in my forehead and down behind my eyes, in that area.
Okay. And how severe is that pain, if you could give it a number? 0 being no pain, 10 being the worst pain.
Probably a 4.
A 4?
Yeah.
Okay. And how would you describe that pain? Is it throbbing, sharp, dull, pulsating?
It's kind of like, it's like if I got like a real strong rubber band and like put it around my head and like squeeze the front of my head like inward.
Okay. And have you had headaches before? Is it common for you?
Yeah.
Yeah. How often would you say you usually get headaches?
I get them once every few months.
Okay. And does this feel like your normal headache?
It does, but this one's just far more painful and it isn't going away.
Isn't going away. How quickly would they usually go away?
Well, usually I just take some paracetamol and go to bed, and then it'd resolve within an hour. But this has just kept on going, and it's gotten worse and worse.
Okay. Have you tried doing that today? Have you taken any paracetamol?
Yeah, I took some paracetamol when lay down, but it hasn't gone away.
Okay. What time do you take the paracetamol?
About an hour ago.
Okay, an hour ago. Okay. Have you ever seen your GP for your headaches, Oscar?
No.
No. Okay. So you don't usually feel as though they're bad enough to worry about.
No, just
And are you on any medications, any blood thinners at all? No. Any allergies?
no.
Any medical conditions?
No.
No. Okay. Do you know if anyone in your family has a history of brain bleeds?
No, don't think
Okay.
so.
Any pain anywhere else? None in your neck or in your chest?
No.
No. Okay. Have you had any falls recently?
No.
Haven't hit your head
No.
past 3 months? No. Do you feel nauseous at all?
No.
No. Any visual disturbances?
No, my vision's fine.
Okay, cool. I'm just going to shine a torch into your eye just to see what your pupils are doing. Cool. You just look at me. Yeah. Cool. And you just follow my finger. Cool, that's great. So I'm just going to have a feel on the back of your neck, Oscar, just to make sure there's no tenderness there. Any pain when I feel?
No.
No? Are you able to look up to the ceiling and then look down to the ground? Cool. And then side to side? Does it feel stiff at all in your neck?
No.
No. So it's just that pain in that forehead.
Yeah.
I'm just going to have a feel of your face if that's alright, just to make sure there's no pain anywhere else. So I'm just going to feel in that temporal artery and the sinuses. Any pain there?
No.
No? Okay, that's great. Let's get you to close your eyes, Oscar, and just tell me which side you hear the clicking in.
Right. Left. Both.
Okay, that's great. You can open your eyes again. So have you been quite well recently, Oscar? Any coughs and colds?
No, I haven't had anything like that.
No? Okay. Is there any funny smells or tastes in your mouth at the moment? So this next test I'm going to do, Oscar, is called the Koenig's test. So what I'm going to do is I'm just going to get you to bend your left leg at the knee. Yeah, and I'm just going to straighten that leg out and just let me know if you feel any pain anywhere. No, nothing?
No.
Cool, that's good. So a negative Koenig sign indicates a lack of meningeal irritation and unlikely to have a subarachnoid bleed. So just the second test is the Brodinsky sign. So I'm just going to get you to lift up your head, Oscar. Just touch it to your chest. Any pain anywhere?
No.
No? Cool, you can just lower that down. So no pain on head flexion, and he didn't flex at the hips. So unlikely, once again, to have meningeal irritation or a subarachnoid bleed. So the next test I like to do for you, Oscar, is just a fast test to make sure you haven't had a stroke. I don't think it's likely, but it's just better to be safe than sorry. Do you feel okay on your feet if you stand up? Good. So I'll support you if you need. Cool. And we'll just walk over here. Is this how you usually feel on your feet? You feel quite steady?
Yep.
Yep. Cool. So if you could just give me a big smile, Oscar. Yep, that's good. And if you could just hold both my hands and give them a squeeze. Cool, that's great. Yep, you can let go now. And if you just hold your arms out in front of you. Yep, close your eyes and then just turn your palms up to the ceiling. And we'll just keep them there for 10 seconds.
2, 3, 10.
Cool, that's great. You can just lower them down, Oscar. And I'll just get you to walk back to the couch. Cool. Oscar's gait seems normal. So it sounds like you're having a tension type headache. So it's the most common type of headache that people get. It can be brought on from a number of causes, like stress can bring it on, or just it can just come on randomly. So it doesn't seem like we'll have to take you to hospital today. I think it'd be more appropriate for you to see your GP within the next 24 hours. But just to be sure, I'm just going to run through my red flags. Oscar hasn't had the headache or neck pain following any neck manipulation. He didn't have a fall, hasn't been to a chiropractor recently, have you, Oscar? No. Cool. He's got no neck pain or neck stiffness. When he was asked to move his head, that was all fine. His headache came on gradually while watching TV. It wasn't sudden. His temperature was 36.5, so that's normal. Hasn't had any vomiting. His focal neurological signs were all normal. No altered level of consciousness with the onset of headache. Hasn't had any trauma to the head. Isn't on any medication or have any medical conditions or bleeding disorders. He's got no signs of temporal arteritis. He didn't have any sensitivity in the temporal area. He's not pregnant. He doesn't have a previous history of intracranial bleeding, doesn't have a family history of an islet, and he was just watching TV at the time, not doing just sexual activity. So Oscar, I think it's appropriate for you to see your GP within 24 hours. I don't think you have to go to hospital for your headache at the moment. If you want, you have taken paracetamol. How much of that did you take?
1 gram.
1 gram, okay. So if you want, we can give you some ibuprofen as well to help with that pain. Would you like that?
Yes, please.
Are you over or under 80 kilos?
Under.
Under, okay, cool. So we'll grab 400 milligrams of ibuprofen and we'll give you that to you. I've just got one more checklist I'd like to check, so that's the non-transport checklist. Oscar's been fully assessed, including a set of vitals and an appropriate investigation into his headache, and no abnormal signs were found, as was no serious illness or injury. I've already gone through the red flags and none were present. Oscar was seen to mobilise when we completed the fast test, and it was his normal gait, normal walking for him. So Oscar's been given an explanation into the next steps of his treatment, so he's been told to call an ambulance back if his symptoms get any worse, or go to his GP if they don't resolve. And we're just going to complete the paperwork now, Oscar, and yeah, we'll give him the paperwork with the link to the notes if he wishes to access them if he desires.